is Antoinette Salter, and I will be discussing with you on the billing errors in healthcare and how to prevent mistakes. Healthcare is always changing and rapidly growing. As medical professionals, we are trying to find ways on how to enhance patient care. As medical professionals, we have to make sure that we are following the procedures properly. And that is such as claim denials, making sure there's no claim denials or any errors in clinical documentation, and making sure that we have the right diagnosis code, which is our ICD-10 code, and also making sure that we provide the right procedure code, which is our CPT code. Patient privacy is a must to follow in healthcare. Also, if we don't collect the correct and correct information from the patient, when the patient comes in through a visit, such as a consultation or a new visit, and we don't collect the patient ID or we don't collect the patient medical insurance or date of birth, this will result in a denial through the insurance because all of the information is not collected from the patient. According to Alyssa Aron and Alyssa Riley from Chicago, she states in her quote that during hospitalization, influences and encounters relative weight, including the severity of illnesses and risk mortality, which ultimately determines reimbursement for care. So this quote was so interesting to me and my topic because as a coder, we have to code to the highest diagnosis. If patient information is not recorded in the chart properly, this will result in an issue for the medical billing department. For an example, if a patient was seen in the ER for self-harm and there is no history of documentation or keywords, this can result in a denial. So keywords that we're looking for is an initial fall or, poisoning of drugs. Those are the keywords that we're looking for. According to Barbara Gisbilla, Beth Hume from Hillsberg in Germany states, these reviewers assist physicians' documentation for self-harm and keywords that support the assignment of only any initial self-harm ICD-CM code, as well as the type of self-harm intended, such as suicidal or non-suicidal. So for an example, with this code and with this, with what they are referencing is when reviewing a medical record carefully, you have to review it because you're looking for keywords of anything that a patient trying to cut themselves or try to, commit suicide as far as killing themselves or having a gun. We're looking for those certain type of diagnoses to code correctly. When a dentist neglects to diagnose an issue, this is another example of an error. When a dentist neglects to diagnose an issue from a patient, it is considered dental malpractice. And this is due to incorrect work that was done on the patient, and which can have a bad effect on the patient's health. A patient does not want to experience false care for their life. Their life may depend on the quality of treatment. According to Galen Alexander and Joseph Hand from New York states, patient encounters are billed by applying a complex of rules. So Medical billers and coders must code continually to the highest diagnosis. This definition, it goes in so many areas as a medical coder. It goes in so many areas as a medical coder. We must follow this as we continue to code and make sure that we're coding correctly as far as the procedure, the anesthesia. We have to make sure that we code correctly each procedure that's being done for the patient. If a patient signs a consent form and is not allowed to provide any information to the family member or the attorney, the patient does have a right to their own privacy. So the patient has a right to sue if they feel like their information is not being protected or not secured. According to the healthcare executives and the Board of Governors in California states, patients also have the right to request and obtain an accounting of these acceptable disclosures under HIPAA or acceptable state legislation. Patients have the right to take legal action if their information is not being secured. Medical experts, nurses must slow down. I do understand that as medical professionals in our daily workflows, in our daily workflows and throughout the day, days can get hectic. Sometimes in the healthcare and the ER and in the clinics, things can get pretty hectic, but it's important for us to slow down and breathe and reread what we are documenting or what we are entering into our software as we do our work duties. Also, training is something that can be done to prevent mistakes. This can also decrease errors, and also this can help each person to be successful in their role. And also, communication must be active in the organization, and also know your teammates' learning style. As for some people might be a person that is more direct, and that's how they learn. Another individual might learn by first saying, hey, good morning, how was your day? And then you say, okay, what you need for them to do. That is very important. And this can reduce medical errors because an individual in the medical profession is feeling more relaxed and feeling that they're capable of doing their work to prevent any billing errors or any mistakes. And so this is very important to follow. I hope that you have learned a lot in the medical field. And I do have here my visual aid that I'm going to show. That is something that is interesting to have. And this is a CPT book here through the HEMA, American Medical Association. This is one of the CPT books for 2021. And I also have the procedure book as a coder. This is ICD-10 PCS procedure code coding book that is also from Ontaman 360. So this is good to have. I hope that you have learned a lot in my video, and thank you so much for taking the time to listen. Have a great day. Bye-bye.